Dr.
Right.
Kolb, today is the 35th World AIDS Day, and this is an annual event that serves as a reminder of the global struggle to end HIV-related stigma and an opportunity to honor those we have lost, plus a rallying cry to continue working towards a day when HIV is no longer a public threat. We're thrilled to welcome you to joining us today at Donor Concierge, Dr. Brad Kolb of HRC Fertility Pasadena, to discuss family building options for folks who are HIV positive.
Well, thank you, Michelle. It's a real honor to be here. And let me give a little context about my background. I grew up in the era of HIV and AIDS. I was in high school when we were first talking about HTLV-3, which was the original designation for HIV. And it was a very scary time for all of us. You just didn't know how to safely move forward as an adolescent, moving into adulthood. And then, unfortunately, we saw the horrendous toll that HIV took on so many young lives. And, it's a very emotional moment for many of us to have lived through that. But we also saw like a rally of people supporting those with HIV. I remember the blankets, I forget the formal name for the project, where as people passed, the loved ones would make the blankets and that would tour around the United States and internationally. And just to think like where we are today, it's like, oh my God, it's such a different world that we live in. And thankfully, we've made such great advances. But these things come slowly over the course of time. So that was, the 80s was in the early 90s was a very challenging time for everybody. But then as we moved into the 90s, thankfully, antivirals started to come on board, and those have continued to refine themselves, and we have a much better understanding of how those affect our lives, as well as our ability to conceive and safely have children. When I started in reproductive medicine, it was in the mid-90s, and that was right as the antivirals were coming out. The late 90s is really when my practice got started. We've always been very open to the LGBTQ plus community. We just sought ways to make this process safe, whether it be somebody that's gay, somebody with HIV, and this includes both men and women with HIV. So that's been quite an interesting journey. But in the early 2000s, there were very few fertility practices that would work with gay clients, let alone those that are HIV positive.
So in the early 2000s, what were the options for people? We were seeing antiretrovirals, successfully helping people live a normal life. But what at that point were the options for people who wanted to have children?
It was very difficult because still in the early 2000s, for single gay men or gay couples, you needed to involve a surrogate. And there was questions about the safety of that, as well as the efficacy of involving a third party who would carry the pregnancy. Or if it was a HIV positive woman carrying the pregnancy, that was still somewhat unknown about the safety features of it. So, fortunately, one of the pioneers for reproductive medicine was the SPAR program, and Ann Kiesling created that program. And she created a mechanism to counsel individuals that are HIV positive, as well as come up with protocols, make sure you're on antivirals, you're testing negative or seronegative for HIV. And then she would collect a number of semen samples, process the sperm, and then test the processed sperm to make sure there was no detected HIV virus there. This was followed by the HART program, HIV-assisted reproductive technologies, very similar type of program. And both programs exist today, although a little bit divergent in their approaches. Most fertility practices use one of these two programs in order to provide an extra level of assurance for both the intended parents as well as the surrogates involved in these cases. But even today, because of the safety that we know about HIV positive men undergoing assisted reproductive technologies, there's never been a documented case where HIV is passed to a surrogate or to a baby. A lot of fertility practices now are just processing the sperm in-house. And I think as long as you have like safe protocols in place as far as making sure individuals are seronegative on antiviral medications, there's transparency involved for the surrogates involved who are carrying the pregnancies, I think any of these approaches are safe and effective means to have children.
Are you saying you can process the sperm in-house, so without doing what we were calling sperm washing?
So most programs, including SPAR and HART, we would do an initial wash of the sperm, typically a swim up, where it's just a way of isolating the motile cells out of the ejaculate, the motile cells being the swimming sperm. And then the way the sperm was, or the ejaculate was processed, the non-motile sperm, but the white blood cells and debris were separated from the motile sperm. So you're isolating the motile sperm from the infectious agents that might be present in the ejaculate. Basically, the programs that are processing are using this type of technique. SPAR and HART took an additional direction, which was to test the washed sperm for the presence of any antiviral agents. And it's not that there were no antiviral agents, it was just non-detected. But I'm going to diverge just for a moment here. In the HART program, when somebody tested seronegative, we never found any positive test results in the processed sperm. So what that taught us is that the processing techniques are very efficient in isolating just the motile sperm. The second question you might ask is, couldn't there be viral particles attached to the motile sperm? And it's possible that there could be. But when you start looking at the science of how an infection is transmitted, you're not going to transmit something like HIV with a single viral particle attached to sperm. You need to expose tissue to thousands of copies of the HIV virus or other viruses such as hepatitis, if that's what you're talking about. So what we found is that it's largely plausibly impossible, not impossible, but highly unlikely that you could transmit HIV, even if there was some virus attached to a sperm, either to an egg and embryo or to a baby or to a surrogate. Let me maybe simplify this a little bit. There has never been a documented case where an infectious agent, whether it be HIV, hepatitis, CMV, or other agents, that has been transmitted by a sperm to an egg or to an embryo. I've never found a single case for any infectious agent. So with the extra steps that we're taking for our HIV positive men, making sure you're seronegative, making sure that the sperm is processed appropriately, the odds or the possibility of transmitting a viral agent to the embryo or to the baby is extraordinarily rare, and it's never happened. So the nice thing is this looks very safe for our individuals that are HIV positive.
Is there really a need to do sperm washing?
The practicality of this is that we have to treat anybody that has any infectious agent. Like I said earlier, hepatitis, HIV, cytomegalovirus, and others. You have to treat it as if it is transmissible, okay? Because the things I do in the clinic with the sperm washing, we have to process the sperm anyway. So why not take those extra steps to make sure the sperm is safe? Let's make sure our patients are seronegative on antiviral medications. The other reason, just beyond the risk of transmission, is we have to go to your surrogate and let them know this is a safe process. We'll talk about the history, but we'll also talk about the steps we're taking care to protect their health in this process. And the cool thing is the surrogates, very seldom do I ever have a surrogate decline. Most of the surrogates are excited to help. They're excited to be part of this journey, especially to a group that has been so marginalized over the course of time. It's a very special thing that they feel like they get to partake in. But we have to do our best to ensure that the surrogates that we're taking every steps to protect their health as well.
I think that's a really great point, because in talking with surrogacy agencies, reviewing surrogate profiles, it does ask the question, are you open to working with a family that's HIV positive? There's still a huge amount of stigma associated with this. And I've had clients, for example, say, very reluctantly tell me their status and say, I'm so afraid to tell people. And so how do you Do you ever see that stigma? I mean, this is part of what our challenge is in this field, is helping to break down that stigma.
I don't really see much of a stigma, maybe because it's the surrogacy agencies that are on the front line of talking to the surrogates. Are they open to this? But for intended parents, please just be completely transparent. It's going to come up in the testing that somebody's HIV positive that we do on all intended parents. If you're just transparent up front, if a surrogate is not comfortable with this process, they shouldn't be coaxed into it. I've never had a problem matching any of my HIV positive patients with a surrogate. My impression is it doesn't increase the length of time to find a good surrogate. And like I said, a lot of surrogates look at this as maybe a badge of honor that they get to help partake in something that is so unique and different in the surrogacy journey. Always be transparent. We're going to be transparent with you. We're going to be transparent to your surrogate. We just want all hands on board for a good, healthy journey.
We've had many cases of our clients being HIV positive, and we haven't found a problem. Again, we have to explain that to the surrogacy agency, and they have already, as you say, they're on the front lines talking with their surrogate candidates about that. What other things should people who are HIV positive think about when they're going into this journey?
I wouldn't look at this journey any differently than any other person that is going through egg donation and surrogacy. Fortunately, we've been doing this for 20 years. I personally have probably helped somewhere between 250 to 300 HIV positive men have children, which is just going back to like when I was growing up in high school in the 80s and watching the outbreak of AIDS is just something that is so unimaginable that I would be here today being able to say something like that. So the journey today, it's no different than any other journey for somebody that needs surrogacy, whatever their need for surrogacy is. Be involved in this process. A big thing of mine for all of my patients is really optimize your health going through this process. I'm not just worried about HIV. I want to make sure my patients that smoke come off smoking, that you're eating good, healthy diets, get your medical care optimized, because this affects the quality of the sperm altogether. And it may affect the health and outcome of the pregnancy. So there's a lot of science that shows this, like be healthy going into this process. So do everything you can to maximize your health. Be an active participant in this journey. Ask questions, do your research, and then clarify, any concerns that you have. The surrogates love it when you're involved in this process with them. They don't want you necessarily overlooking their shoulders per se, but they want to know, they want to know you. They want to be part of this journey with you. And that's, being involved with you throughout the whole journey. So at your match meetings, make sure you're finding a surrogate that you're comfortable talking with, somebody you like having this journey with. There's lots of surrogates to work with. It sometimes takes a little time to find the right surrogate, but that's okay. But be involved in this journey with your surrogate. They want your support through this journey too. For those that can be there at the birth, I think that's a wonderful time to experience just a spectacular event. It's the birth of your child. A lot of the surrogates and intended parents stay in contact beyond the birth of the child. So this could be a very fixed journey where, okay, you part ways after the birth of your child, but for many patients, it's a lifelong journey together.
What about HIV positive women? How is their fertility journey approached if they need help with getting pregnant? How would you approach that?
So HIV positive women may have had a little bit more of a difficulty garnering the medical acceptance with fertility specialists, that many of them now can go through treatment with their obstetrician gynecologist, doing things like artificial insemination. I probably worked with about 24 HIV positive women, and it's the same basic tenets. First of all, we want to work them up to make sure that their egg quality is good. We do genetic evaluations. We optimize their HIV status, meaning they're seronegative for 6 months going into their treatment. And the cool thing is the infection rate that's passed to the fetus, the last time I checked, is less than 1%. But it's a very safe process. You continue on your antiviral medications. You're going to have your medical team there throughout your whole pregnancy, meaning your infectious disease specialist, your obstetrician, the fertility doctors involved. Everybody's going to be involved in your care. And you continue on, like I said, on your antivirals. In the old days, women that were HIV positive, it used to be just automatically you had a C-section. Now they don't find that makes any difference. I think it's a very safe process. Once again, the risk is not zero, but if things are done appropriately, you have a team that's very accepting of this journey. You should have a healthy journey for both you and your baby. But it's also important to make sure that you have an obstetrician that's aware of HIV and pregnancy, and they're like on board. They're not, they're if it's somebody that's not comfortable with this journey with you, find another obstetrician. There's lots of great obstetricians out there that know how to take care of this pregnancy and keep it safe for both you and your baby.
That's really good advice. Do the drugs that people take who have HIV, do they have any impact on eggs, sperm, future children, any side effects?
The way the antivirals for HIV work, they only affect viruses. They don't affect the normal human cells. So these are category B drugs where there's no documented adverse side effects to the health and well-being of the baby. Just to extend that a little bit further, there's no negative impact on egg quality or sperm quality. I think an important piece of advice is it typically takes a male about 2 to 3 years contemplating, can I do this? Should I do it? Start the process early as far as like maybe start optimizing your healthcare, making sure you're following up with your infectious disease specialist, get a semen analysis, just get some basic groundwork and start taking care of your health and any issues that might delay this process when you decide to move forward with treatment. As far as like a fun resource, I'm going to share one with you. This is a project that I created several years ago. So Love Comes First. This is the book, Love Comes First, Creating LGBTQ Families. The author is both myself and Melinda Merker. You can go to lovecomesfirst.com. It's a nonprofit, but what we try to do is tell the story of reproductive options for individuals that belong to the LGBTQ plus community. Great patient stories there. There's educational resources. There's interviews with experts in many different realms associated with assisted reproductive technologies. It's something, it doesn't matter who your fertility doctor is. It's something that hopefully it helps your journey.
Where are we going to be 15, 20 years from now in terms of people with HIV becoming parents?
Well, if we're fortunate, there'll be some kind of cure or vaccine for HIV. We still have a ways to go to promote parenting amongst LGBTQ community in general, especially those that are HIV positive. We need to do a lot of work for the trans community as far as bringing their acceptance into the fertility practices. I think a lot of what we're going to see over the next 15 years is continued acceptance within medicine to support those that are desiring to have families and through surrogacy. The cost to use an egg donor and surrogate is prohibitive for the vast majority of individuals. Legislative work to make insurance more inclusive to reproductive rights is probably the next frontier I think that we really need to conquer to bring the option of parenthood to those that can't afford the costs associated with surrogacy today.
And what is the additional cost to go through the SPAR or HART program?
In addition to the cost of surrogacy, egg donation, those types of things, there is a cost either through HART or the SPAR program, probably looking at something in the $10,000 range. And I think that's why some of the fertility practices have chosen not to participate in these programs and just in-house it. I think the real value is to give people confidence that they're not going to pass the virus to their children or surrogate, and it gives the surrogates confidence as far as moving forward. The HART program, something that I had co-founded, in addition to the processing of the sperm, we have an infectious or an HIV specialist that does counseling with the intended parents as well as the surrogates and answers all those questions. So it's a third-party person that I think helps make this journey a little bit more comfortable for all those involved. We also do monitoring through the pregnancy and birth, testing for HIV and the surrogates and the baby. How we know our data is that we've never had a virus transmitted. And we also do in the early first trimester for our surrogates after the embryo transfer, we do use Truvada. Initially, it was just to minimize the risk of transmission of HIV. I think really at this point, it's more to give the surrogates confidence that they're being cared for and looked at as far as moving forward. I'm sure that there's other practices that follow same tenets as what we do within the HART program as well. So there's lots of great options out there for patients.
Can you explain what Truvada is and what PrEP is?
Truvada, or probably more commonly known as PrEP, is an antiviral medication. It's safe to use if there is a pregnancy, that it helps knock down the transmission rate of HIV, knocks down the transmission of HIV about 80 to 90%. Giving out to the surrogates when there's a transfer just helps add that little bit of confidence for them to move forward on this journey.
And would you say all of the surrogates take this, or is it an option?
All of my surrogates take it. A lot of fertility practices don't use it. And I certainly don't fault those that choose not to use it. We've just learned through the last 20 years is not a single reported transmission of HIV. It's a very safe process for either use the PrEP or not.
How does someone get in touch with you for a new patient appointment?
First of all, if you're just interested in learning a little bit, lovecomesfirst.com. I'm going to give a little pitch for that. So myself, I'm with HRC Fertility in Pasadena, California. Just have some questions you're exploring, or if you're interested in moving forward with the journey, we're here to help. I'm just excited to be here, especially at this important milestone, 35 years, where this has become a very safe thing that was unimaginable 35 years ago.
Absolutely. Yeah, definitely. And I also, remember the 80s and the 90s and the fear that was around HIV, and it is incredible to me how far we've come. So, but as we say, we remember and we commit. That's the theme of this year's World AIDS Day. So that's why we're here.